Thank you all for waiting out here, and thank you for being here today. I wanted to bring representatives from our public safety officials in East Baton Rouge Parish for a unified message on our response to the COVID-19 pandemic. Please remember, and we consistently say this, that this is an evolving situation. We're dealing with a unique situation, unprecedented like never before. It's an evolving situation, so you will hear us continue to say that. By the time we finish this press conference, there may be more emerging news. But joining me today is Sheriff Sid GOUTREAUX, Baton Rouge Police Chief Murphy Paul, District Attorney HILLAR Moore, and East Baton Rouge Parish Medical Director Dr. Dan GODBEE. First, a quick update on our efforts. We had a very successful first day for the MOSEP Community Testing Center at Baton Rouge General Mid-City Campus. You probably heard us talk about that. 183 tests were conducted. Only 11 people showed up without a referral, which means people are paying attention to our message. These tests are sent off to a private lab. It will take 3 to 5 days to get results. I want to stress at this point there are limited tests, so until more tests become available, testing kits become available, only vulnerable individuals should get tested. And that means our elderly population or people with underlying health conditions. Call ahead to your doctor. People who have symptoms, particularly younger people, are still contagious. So for the next several weeks or longer, we need to slow the spread of the virus. That's why we're being so aggressive about limiting our crowd sizes and social distancing. We're practicing that. As you know, Governor Edwards is ordering the closures of bars and theaters and dining rooms. However, we are encouraging our community, as we talk about dining rooms, to do pickup or take out to support our restaurants. We may have to make some big changes during our lives in this season, but the more aggressive we are in adhering to practices such as social distancing, then the quicker we will get through this. Our law enforcement will enforce bans on large crowds. But to speak more about our public safety space, I'm going to ask Sheriff Sid GOUTREAUX to come forward.
Thank you, Mayor. Good afternoon. For the past month at the Sheriff's Office, we've been changing and adding policies and procedures to meet the needs, to make sure that we're ensuring the public safety as well as the safety of our deputies and as well as with the inmates that are in Parish Prison. We've implemented a screening process, as you see here, where all personnel coming into the prison will be scanned, given the questionnaire, and have the temperature taken. If anybody exhibits any of the symptoms, then they won't be allowed to enter into the prison. We've suspended all visitation with prisoners. Only bondsmen and attorneys will be allowed without symptoms to enter the prison, and they'll have to do their interviews through glass or by video with the inmates. Nobody's going to have direct contact with the inmates. Also, the warden has worked with our phone provider to have 2 free 10-minute calls per inmate per week. There's going to be no transfers from East Baton Rouge Parish Prison to any other facilities within the state or anywhere for that matter, and that's DOC requirements that have been put in place, so there'll be no transfers. We will not be sending anybody to any other prison for housing, nor will we be able to take anybody from any other prison to East Baton Rouge for housing. We changed up our booking procedure a little bit. As it is before this event has taken place, anybody that's brought to the prison to be booked, if they exhibit any medical problems or issues, they have to be taken to a local hospital facility to be treated or whatever, and they either admit them in the hospital if it's necessary, or they bring them back to the prison. So everybody's going to be evaluated by our medical personnel before they're booked. If they're exhibiting symptoms from COVID-19, they will be taken by the arresting officer to the medical facility for further evaluation. And as I said earlier, we have a section in the prison that the warden has made as an isolation area. So anybody we got to put away from the population for 14 days or whatever the case may be, or tested positive, then they're going to have to stay in those areas. We've also requested the courts to look and see if there are any current inmates who could be released early to reduce the number of inmates and help us out during this time. That's something that has to be agreed on by the judges, by the DA, and by the public defenders. I do not, as sheriff, have the authority to just decide who can get out and who can't. That all has to come to us from the court. They're all put there on court order, and we cannot just release inmates because we feel like they're not that big a threat to make room or for whatever we have to do. So HILLAR may want to touch on that a little later. Video arraignments, you know, as you all know, the 19th JDC has suspended court, but we will still be conducting daily arraignments for people that have been arrested that need to be arraigned. It will all be done by video. We have a mock courtroom set up at the prison, and the judges have agreed during this time period to use that video arraignment, so we will not have to be transporting on the average of 100 to 125 inmates from the prison to the court. So that'll be done all the arraignments will be done by video. As far as misdemeanor arrest, we will no longer be booking persons for misdemeanor charges. But let me explain that. With the exception, DWI, domestic violence, or violent offenses. Anything that in that category, whether it's a misdemeanor or not, they're going to be booked. We're working both with the mayor over the next few days, myself, Mayor Broome, Constable Williams. We've been meeting already to try to look at maybe some alternative housing in the event that there is an outbreak at the prison or with new bookies. So we just started working on that, and the mayor, I'm sure, will elaborate on that at a later date if we can work those things out. Now let me talk about the criminal division. We're off to prison, but I want to tell you what we're doing in the criminal division. We're going to have all our command staff meetings. Any interdepartmental meeting that we have to have will be done by video link in order to limit contact with persons. We've canceled all our training and travel, including our Carter class, which is our basic training class. We're suspending all vacation for all essential personnel. We're suspending all work on any traffic grants or things that we have that pay overtime for us to enforce traffic laws or whatever. We're trying to limit direct contact with the public for their safety and our safety as much as we possibly can. As far as answering calls, in order to limit contact in that regards, we're going to do what we have to. We're going to continue to respond to any 911 call, any emergency calls for service such as homicides, attempted homicides, shots fired, crimes of persons and property, disturbances, wrecks. We're going to keep responding to those calls. But a lot of our call volume, the people that are calling really don't want any direct contact. They want us to they want to file a report, and they wish to over the phone. We're going to encourage the public to as much as possible. If we don't have to come out, if we got to come out to investigate a crime scene, collect evidence, talk to witnesses, so forth, we're going to do it. But we're asking them on those non-emergency calls if they would please work with us and let us take their report over the phone. It'll be handled by the deputies as they would be any other situation. We're going to take it from there and work with people to resolve their problems in that regards. But we're really trying to limit the contact with public as much as we can. and we asking people to please cooperate with us. I can assure you that in regards to public safety, we're not going to turn anybody that needs to be in jail away. But if there's certain felony offenses that we can give misdemeanor summons to that don't pose a threat to the public or to the public in general, our personnel and so forth, then we're going to do so. We've been in the process last night, and we've been in the process now for over a month in trying to procure all the necessary protective gear and products that our personnel need to ensure their safety and better serve the community. We're looking at providing additional medical assistance to all personnel that may have come in contact or exhibit any of the symptoms of COVID-19. And we're having the proper decontamination and cleaning and disposal procedure and equipment that will be in place this week to handle any of that. This morning, we had a meeting at the Sheriff's Office. In attendance was Sheriff's Office personnel, chiefs, Baton Rouge PD, State Police, Baton Rouge Constable, Baker Police, Zachary Police, Central Police, LSU, Southern, Baton Rouge Community College, Airport Police, EMS, and Baton Rouge Fire Department. We want to make sure that we all stay on the same page, we stay focused in order to continue to serve the people of this parish as best we can. And we are all committed. I can tell you some of the people that were there this morning are standing behind us, and the mayor's, she's already elaborated on the importance for us to continue to do what we do. We're having to change things on a daily basis because this whole COVID-19 thing, as y'all well know, is changing day to day, sometimes hour to hour. And the mayor's MOSEP has kept us informed. We got people here when the mayor activated the Emergency Operations Center. So all the necessary players are all upstairs, and we're all working together in the first responders and the law enforcement community to work together, and we'll continue to do so. That's all I have, Mayor. So at this point, I'd like to ask Chief Murphy Paul to come up. He's going to tell you some other things.
Thank you, Sheriff. I just want to state again, we all, the law enforcement leaders in Baton Rouge, all of you chiefs and law enforcement leaders all agree. And I want to emphasize that we are all in agreement with those changes that the sheriff just spoke of. I want to just talk to you on two issues. Specifically, our governor has issued a directive, and we're going to follow that directive. We talked about how we can enforce that. We believe that our community is going to be in compliance. That's why it's so important to encourage cooperation and to listen to the experts and taking those preventive measures. We do understand that we have also been given authority by our governor to issue a curfew. We believe at this time that we're going to get the compliance that is required, so we will not have to do that. However, we're going to be continuing to reassess that, and if we believe that a curfew is needed, that we're going to be united as law enforcement leaders in the parish, and we're going to make that a parish-wide curfew, not just specific to one municipality. Thank you.
Good evening. Just give you a little update from the criminal justice side. This entire virus has been extremely disruptive to our entire criminal justice system, one that I've not even seen at the time with the flooding and the hurricanes that we've seen before. It's really taken a toll on personnel, not only the first responders here that you see represented here, but also all of the court personnel, the mothers, the wives, who have to now stay home with the children who are no longer in school, or taking care of elderly parents or family members. It's really cut the ability of the staff to come to work full time, but we're trying to work outside of the office through computers, virtually work, try to make this work. As you know, there's no court now for 2 weeks. There are no jury trials for 1 month, so the court process is really slowed down to a halt. People are still being arrested. People are still doing things that cause them to go to jail. The police are doing their best that they can, but we believe that we're going to see compliance through our citizens. That's what we encourage. We are going to continue to do the expedited billing. Those people who do get booked and are not bonded quickly, We're going to try to expedite their cases to make some decisions quickly on, whether it's a dismissal, a charge, or reduction in charge, so that process can continue. We've met with all of the judges, or most of the judges of the criminal court and the civil court bench last week, to try to come up with a plan as to how can we continue to serve our population. What can we have done virtually by cameras in the courtroom and in the prison? We are somewhat limited by our technology that we have at this point and by the space that we have available at the Parish prison and just moving prisoners around, which is difficult for the sheriff and the prison to accommodate. So we're working on those issues right now. As you heard, the governor's issued a executive proclamation, which makes things easier for us in how we operate. Has also given us some help with the time constraints that we have for speedy trial, restraints for things for defendants as well as prosecutors. So between the executive order by the governor and the Louisiana Supreme Court, that has really helped things with us. Also, the DA's office, myself, have met with the public defender's office as well as the sheriff and the mayor. So we're trying to look at who is in our prison population at this time. Do we have people that are vulnerable? Look at their ages, look at their health concerns. Also, there are some things that we can do for this particular group of inmates to help them, keep them out of harm's way. Can we also look at other types of crimes or other defendants that are housed as prisoners right now? How can we help and assist the Parish prison for the health and safety of not only the prisoners but also the deputies that serve there, but also while at the same time maintaining public safety? So we're meeting with them on a daily basis to look at cases that we can potentially resolve, either through a dismissal, a plea, or a type of bond reduction. So to let you know that the Public Defender's Office and the District Attorney's Office, along with the court system, we're working on that now to hopefully help any type of problems at the Parish prison that may eventually arise as we continue to monitor this virus. Thank you.
Thank you, DA Moore. I want to thank all of the law enforcement officials who are joining us today. Chief Dunn from the Baker Police Department, our constable, Terica Williams. I appreciate the support of our Councilwoman Wicker, who is out here. And now, thanks to all of the law enforcement officials who have been in discussions to make sure that we are in alignment. It's also important to understand that during a season like this that there are changing processes, right, as it involves EMS and our fire responders. Our fire chief is out here as well, Chief Smith. And so I have asked our East Baton Rouge Medical Director, Dr. Dan GODBEE, to come out and talk a little bit about what a first responder's life and what is changing in that sphere and that space during this season of dealing with the COVID virus.
Thank you, Madam Mayor. We're restricting the number of people that can accompany patients to the hospital to one person in our ambulances. This keeps our patients and our providers safe, and it also contributes to limiting the number of people in the hospital emergency departments. Please know that we are still responding to all 911 calls, and please let the 911 operator know if you have traveled outside the country and exactly what your symptoms are, and if you have been exposed to someone who is COVID-19 positive. Please be specific and honest when you're calling 911, meaning let them know your symptoms. Don't be surprised when the 911 operator may ask you a lot of questions. They're trying to provide the best response and most appropriate response to your situation and your condition. If you don't have a doctor, please call 211 for further instructions. If you do decide to go to an emergency room, which we are advising you to please attempt not to go to emergency departments, but if you do go to an emergency room, please be straightforward with them about your symptoms and your travel history. The best way to protect yourself is to limit potential exposures. That means, as the mayor pointed out earlier, social distancing. Attempt to stay greater than 6 feet away from other people. Wash your hands, cover your cough. The best method of washing your hands is to use soap and water. Don't be alarmed if the firefighters and the paramedics show up in protective gear, meaning gowns, masks, gloves, goggles, that kind of stuff. Please stay calm. They're trying to protect both you and themselves. Don't be surprised if the first responders don't enter your home immediately, or your building or your room immediately. They're trying to do an evaluation from a relatively short distance to continue with the social distancing even while being under professional conditions. They will need to know how to respond and any equipment they may need to bring with them. We're here and we continue to respond to all emergencies. Assured, we are not overwhelmed, we are prepared. You may not be transported to an emergency department when you call 911. We may give advice and education and provide on-site therapy and then recommend to you that you stay at home. I want to reiterate that the best source for the COVID-19 questions for the general public is either the 211 phone call or contact your primary doctor. Thank you, Madam Mayor.
Thank you. Thank you, Dr. GODBEE. Thank you, Chad GOUTREAUX, Chief Smith, all of our first responders who are represented here today. And I want to reiterate, if you think you have the symptoms, call your doctor first. We prefer that you don't just go to the emergency room. That's not the best way to do it. Call your doctor first, and they will give you instructions if you feel you have the symptoms. And so it's important to understand, as I said, that this is a fluid situation, constantly evolving, but together, working together, keeping the lines of communication open, having the support that we do from our first responders and the rest of the community, I believe that we will get through this. And I certainly solicit everyone's thoughts and prayers as we move forward. Now I'll take any questions that you might have. Well, let me start first by just talking about the restaurants. As you know, the restaurants are asked now to shift to takeout, that there will be no in-house dining. So it's my belief, based on conversations that I have had with the restaurant community, even as recent as this morning, that it's their goal and their desire to comply with that. So I say that to say that most restaurants will not be offering in-house dining, but they are shifting now to takeouts, call, takeout, or drive-through. So you will see that constantly happening. So I believe, I expect the likelihood of that taking place, in-house dining will not. And we expect our restaurants, and I know they will, I feel very comfortable that they will because of conversations that they are going to voluntarily comply. And we also expect our citizens to voluntarily comply with these instructions and guidelines, meaning support our restaurants, but do pickup or drive-through. Well, I'm gonna let our law enforcement come up here, but I'm gonna say once again, and I've said this yesterday, if you don't comply with what we're asking you to do, you're not only putting yourself at risk, you're putting this entire community at risk. That is irresponsible. So I am asking, if you know of anybody who is not complying with this request, call us, call law enforcement, and let them know. We are doing our best to ask people to operate in a spirit of honesty and integrity, to understand the seriousness of this COVID-19. And I believe that the community at large understands that. And so we are asking people to comply. If they don't comply, then we'll ask law enforcement to take another step. But let's hope that everybody understands this by now. We're not coming out here day by day reiterating the same message for people to be rebellious and say, I'm going to do what I want to do. We have, I don't know what the latest number is, but 171 cases right now in Louisiana. Currently, we have 4 deaths. What we're talking about is not something frivolous. We're talking about life or death issues right now. So I implore everyone, do this, be in compliance, and perhaps this will be short-lived for us. If not, the more we expose people, the longer it will take us to get through this. Do you all want to add something to that?
As the mayor said, we expect voluntary compliance from most of our citizens. If they don't want to comply with a directive that's come from the governor or the mayor in regards to this, we're going to disperse crowds that are over the limit. If they don't adhere to that and they become unruly, we're going to arrest people. That's just the way it is. And I want to make this clear for both of us and everybody else here from law enforcement. We're saying we're not going to book any misdemeanors. I hope that the people out there that are listening or watching this realize we're not going to stop enforcing our laws. We're not going to stop that. And the people that need to go to jail will go to jail. But we're asking everybody to please bear with us through this. We're not going to do anything, neither one of us or anybody else in law enforcement, that's going to do anything that jeopardizes the safety or the well-being of our community. And so we're going to enforce the laws that need to be enforced when they need to be enforced.
Yeah, and let me say this, because it's important for us to understand the importance of messaging, education, and awareness. We need people to listen. If there are community leaders and people out there who don't understand, one of the things we don't talk about when it comes to leadership is the ability to follow, learning the art of fellowship. And right now, we are not the smartest ones in the room. The smartest ones in the room are those experts, those at the Center for Disease Control, those who are experts in this. And we have to listen. We have to listen to them because this community cannot afford the final conclusion if we don't. Our concern is not that the first responders that you see behind us are not going to rise to the level of their capabilities. We're capable of doing a lot, and we do it every day. But our fear is that we will fail to the level of our preparedness. We are preparing. We're taking directions from our governor, from our mayor, and we're asking you for compliance. If you don't want to do it for yourself, we got a young generation out here who think they're healthy. Look, it's for your mother. It's for your grandparents. Let's be responsible and do the right thing. Let's listen to what the experts are telling us, okay?
Are y'all hosts like this?
So we've had a couple since we've been here this weekend. We were able to address that. We are grateful that in this particular case, there was one this weekend. We sent one of our senior level deputy chiefs out there. He was able to make the right contact with the persons involved in there, and they were able to break that event up. It took a while, and they were dispersed, and there were no incidents. So we're excited that people are listening when we make those contacts, and we believe that that will continue. However, if it doesn't, then we'll do what we have to do what's in the interest of this public.
There again, if we see a violation a blatant violation of traffic laws, we're going to enforce the traffic laws. We're drawing back from the grants that we receive for public safety grants that pays our deputies, our officers, extra duty money to go out and enforce traffic laws directed by the state that they want us to enforce. We're not going to do that through this period. But I don't want to give a false sense thinking people can drive the way they want to drive. And that's not going to stop with our people. We got deputies out there who are not working the traffic grants, who are working just like officers that are working every day just to enforce laws and keep people safe. And we're going to do that. You know, I'm going to say this, and we're all Americans. We live in the greatest country in the world for our freedoms, and we used to going places when we want, how we want, where we want. And this is really disruptive to everybody's way of life. But it's something that has to be done to keep this crisis from being much more than it could be. And there's a time that we're going to meet that crest. And I'm sure a lot of these restrictions are going to be lifted. And I'm hopeful that, and I'm prayerful that those things will happen sooner than later. But in the meantime, we just got to all come together as Americans and realize, hey, this might affect somebody's grandmother. It might not affect me, like the chief said. The younger generation, I've had them tell me, well, I don't have to worry about it because I'm not going to die from it. Well, you got to worry about your mama. You got to worry about your daddy. You got to worry about older siblings. And that's what this is all about. I mean, I know the mayor hates to do any of this, right? I mean, we don't like it. None of us do, but it's necessary. And we just think most of the people will comply.
And I'll say this about our younger generation and our millennials. I would say that no one should think that they're exempt from this. We know that there are vulnerable populations, and people who have underlying health risk are certainly in that vulnerable population. But because of the uniqueness and the research that's still going on with COVID-19, it would be irresponsible if we just told everybody, oh, you might not get it, you might not get it. Everybody should act very seriously and guarded about this. I don't care what age you are. You have to take this seriously. Any other questions?
We have roughly 1,600 inmates at this particular time. As you all know, that if we go over that number, that's mandated by the federal government that we don't exceed that number in our facility. If we go beyond that number, we've had for years, before I was sheriff, past sheriff, and so forth, we have for years, and we've got a provision in the law that allows that the sheriff can contract with other facilities in other parishes to house our overflow. There's been times that we've had as much as 500 to 700 inmates that are housed out of parish. Right now, as we speak today, we only have about 120 that are housed out of parish. But does that answer your question?
Yes, but follow up. Have any tests been conducted in EBRP?
We have done preliminary testing because somebody may exhibit a symptom or symptoms. But so far, we hadn't had anything positive. I pray that we don't, but with the prison population, and we've got a lot of sick people in there, we got people in there with HIV and other things, they're vulnerable.
Do you have estimates of how many have been done so far?
I'm sorry?
How many tests have been done so far in the facilities?
Other than preliminary tests that didn't require, a lot of them have been checked, but there's nobody that's had to been so far that we've had to send out to a medical facility or that's been at this point been diagnosed with having any COVID-19.
So screening, but no COVID-19.
No, as of right now, we haven't identified anybody, but we continually monitoring that. We're continually trying checking with that and testing. Yeah, we've canceled, as I said earlier, we canceled all of our vacation for any of our essential personnel. We've done it in the past, and we've got contingency plans in effect that if we have to, we're going to move people around depending on, we got 800 something employees. I know you got about as much too. So, we fully realize that we might have sickness within our ranks. They might have somebody home that they got to go care for. So we're well prepared to move personnel around throughout the department to suit whatever the needs are.
In terms of the tests, I would say we are consistently expecting those tests on a regular basis. But as you know, the tests, there are not a plethora of tests available. Right now, I will tell you, we've got over 100 people at our new testing site. And so we're consistently on a day-by-day basis asking for additional tests. Jared, do you have anything else to contribute to that? Okay. Thank you all.